been more than a month since I recovered from COVID-19. Before I share my story, I want to introduce you to my sister, Dr. Belen Dofitas. She was instrumental in my recovery. I'd like you to meet my sister, Dr. Belen Lardizabal-Dado. She's a volunteer doctor for the PGH TeleGabay. Belen, tell me more about TeleGabay.
Well, the Philippine General Hospital TeleGabay is actually a free service that we give the public regarding COVID. So anybody who has concerns or questions or who actually has COVID can message us in our Facebook page. And we have volunteer doctors who can chat with them or actually call them, to give them advice, guidance about the home care of COVID, especially if it's mild to moderate. And sometimes we handle also severe COVID cases and refer them to like hospitals if necessary.
How should we take care of ourselves, our diet, our health, and
Well, during this COVID pandemic, it's really important that you keep your immune system strong so that you can fight the COVID virus should it enter your body and also recover faster and better. So, although there is no proven prevention yet, in terms of what medication can you take to actually prevent the COVID infection from spreading, you can do a lot of measures to strengthen your immune system. So for our basic nutrition, balanced diet, of course, enough sleep, enough exercise, and of course, we need the sunshine to develop vitamin D in our bodies. And because we've been in lockdown for such a long time, a lot of people are probably deficient already in vitamin D. So I would like to emphasize that we have to spend maybe around 5 to 10 minutes in a day to expose, let's say, our face, our sun-exposed skin, like the arms, to the sun so that we can generate vitamin D in our skin. But if you cannot do that regularly, I would advise vitamin D3 or cholecalciferol supplements, dietary supplements daily. And the minimum requirement for adults is around 800 international units a day. For children, is around 400 international units a day. And it really helps reduce the risk of various illnesses, and not just COVID. So it's like a general protection. It's really important that our nutrition is ensured. So you must have more fresh vegetables, green leafy vegetables, and fresh fruits, especially the colored fruits. And 1/4 of your plate is around carbohydrates and 1/4 for proteins. So that's what we call the Filipino plate. And it's very basic measures we can take that will help us with any infection or disease. So aside from that, of course, we do need our de-stressing activities because COVID pandemic has generated a lot of stress and anxiety. So we need yung mental health breaks. For example, watching comedies, get laughing more, taking breaks from your digital devices, watching less of the sad news, just also socializing, even if it's online, is very helpful for our mental health. And knowing who to call, who to talk to if you are feeling anxious or depressed, okay? So we have some mental health hotlines available and they're free. So if you contact PGH TeleGabay, for example, feeling anxious about COVID, we will actually send you hotline numbers that you can call at any time of the day. So these are things that we have to take care of, our physical well-being, our mental well-being, and even spiritual well-being.
symptoms to watch for?
Okay. So the COVID signs and symptoms are really difficult to differentiate from like the common cough and colds that we've been getting over the years. It can start out with a fever or sore throat, colds, cough, and then later develop through having headache, body aches, and then later you can have loss of taste and loss of smell. So which actually helps us differentiate it from the usual common cold or cough or even allergies. So the moment we have patients who complain of loss of smell or loss of taste, then this really helps us clinch the diagnosis of COVID-19. But if there's a history of being exposed to another COVID case in the past 2 weeks, or the patient has been going out and mingling with other people, especially, for example, a high-risk exposure like eating together with others, like in a family reunion, no, or in a get-together, then that raises the suspicion that the patient may have COVID-19. When you have these symptoms, they could develop actually maybe as soon as 3 days after the exposure, or maybe within the 2 weeks after the exposure. It doesn't happen the next day after exposure. So sometimes people don't remember when they were exposed. These signs and symptoms are often mistaken for like allergies. So a lot of people will sometimes be in denial and say, oh, I'm just having an allergy, you know. But later on realize that it's something more serious when they develop other signs and symptoms. So I would like the public to really be aware that when you have these early signs and symptoms, like within the first 3 days, please have yourself tested. So RT-PCR swab test would be the best if you have it available right away. But if you cannot have yourself swab tested immediately, then an alternative would be the saliva RT-PCR test. Sometimes we use the rapid antigen test for the COVID-19 virus. So these are also acceptable, especially when you have symptoms. I think that would be the very first advice I would give if you would have these symptoms. And then, well, you have to alert your close contacts that you're having symptoms. Please don't hide it. For example, you developed a cold. You should not actually mingle with other people already for the safety of others.
So among the signs and symptoms, what is the most critical to monitor?
For example, you have other illnesses like diabetes, hypertension, or maybe you're older or you have weight problems, overweight. This is what we call risk factors for more severe COVID infection. I think that the most important to monitor in these cases, if you are what we call moderate cases of COVID, is of course the fever. So monitor your temperature. That's the easiest to do every morning and the evening, and then write them down in a chart, in a monitoring sheet, okay, every day. And then that reflects your infectious state, because while you have the infection, your body will generate a fever also to try to fight it off. If you are a moderate case of COVID, and you are at risk actually of having a lower oxygen level over time. So maybe nearing the end of the first week of illness, that's when the oxygen level can actually lower below normal. So we always advise these patients with high risk of severe COVID to borrow or buy a pulse oximeter device. So this is a very simple device that you can clip onto the end of your finger, like the second finger, and it will help measure the level of oxygen in your blood. So why is this important? Patient may not feel any difficulty breathing at all. So he thinks, he's okay, he's just having mild symptoms, but he doesn't realize that the oxygen level in his blood is actually becoming lower and lower over time. So the moment that it hits like say 93% or lower, that's really alarming already. We really have to do more interventions to prevent a severe state among these patients. So that is, we monitor again what we call oxygen saturation level every morning and every evening at around the same time. But when the patient can see a trend that it's lowering towards 94%, that's really the time that you have to alert your doctor, and that, okay, my oxygen saturation is already 95 or 94, and it's always there. So it's not going up and down, but it's really constantly low. Then your physician can advise you more medications, and of course, better monitoring if you are in a health facility, because that is the most dangerous actually sign, the oxygen level getting very low, and the patient will need oxygen supplementation aside from other medications. You can actually prevent more severe COVID at that point. Yes, because of the proper monitoring, the proper medication, and guidance, no, from the doctors. A lot of people get severe to critical COVID because they were not aware that their oxygen levels were already lowering. Sudden deterioration can happen, like usually close to the end of the first week. So that is when the inflammation caused by COVID suddenly gets more severe, okay? And it starts damaging our blood vessels, it starts damaging the way our lungs work, you know, and that's why the oxygen levels go down at that point. And that really leads to complications in the patient and possible death. So a lot of people say, I feel fine, so why do I have to go to the hospital to be monitored? No? And some people are afraid to go to the hospital. They'd rather stay home and suffer the cough and the symptoms. But it's very difficult to help the patient when the oxygen level is pretty low already. So a lot of times we get patients messaging us because they're so desperate to find a hospital room, you know, or even an emergency room that's not full. So we want to emphasize this monitoring, you know, even before a patient gets severe. So if it's really possible to get the pulse oximeter device or borrow it, please do. All other symptoms or signs can also be written down on that monitoring sheet, like the cough. How is the cough? Is it really a bad cough? Do you have difficulty breathing? That's one of the signs also you should be monitoring. Any difficulty breathing, no? Or any shortness of breath. And so we don't want it to get to the point where the patient has difficulty speaking. So when that happens, we know it's really a severe condition. So the oxygen saturation is a very early sign of pneumonia, COVID pneumonia. And sometimes there is no difficulty of breathing, even if the oxygen level is already low. So that's why you have to monitor the fever, difficulty of breathing, oxygen saturation, and even how fast you breathe in a minute, what we call respiratory rate. So normally it would be like 20 breaths per minute or 16 to 20 breaths per minute. But when it starts getting above 20, you know that the patient's having difficulty breathing. Other symptoms actually of COVID that are lesser known, there's diarrhea. So COVID can actually cause a watery diarrhea among patients, and sometimes it can be severe. So the patient has to hydrate the moment it happens. Like we have oral rehydration salts, for example, no? So that you don't weaken any further. One of the other not so known symptoms are skin rash. COVID causes skin rashes. It could be at the same time as the other symptoms. It can also occur after the patient has recovered from COVID. So the history of having COVID might be able to lead you to the diagnosis that, oh, this skin rash that you're having, which can look like measles, no, or some other viral skin rash, may have been triggered by COVID too. So, for example, having this like wounds, no, or red spot or bluish discoloration of the fingers or the toes is one of the COVID skin signs. So COVID affects our blood vessel. So you will see that in our fingers or toes, and you can develop this, red or pink rash. So it could also be like urticaria, mga pantal. So those are the lesser knowns, and there's also the nervous system. It can be affected by COVID, like dizziness, being unstable, having tremors. So these are lesser known. And sometimes after recovering from COVID, you can even still have what they call brain fog. Feel like fuzzy, your brain is fuzzy, you can't really remember or think straight right away, or you're off balance. We cannot get that there are nerve signs and symptoms due to COVID.
This is a two-part series, so stay tuned for part 2, which will be about the recovery period of COVID-19 and the Swiss cheese model of intervention.